Okay, let's talk about disorders of paraphilia or paraphilic disorders. These are disorders that are characterized by intense sexual urges or behaviors involving situations or objects that are outside of the norm of sexual behavior. Um, you may get an individual who has multiple of these. Infrequently will a person even receive the diagnosis, but there are some theorists who suspect that these patterns are more common than we know. Um, Now, in order to be diagnosed with one of these, you have to have had a history of at least 6 months of experiences where uh, you're experiencing sexual arousal or engaging in sexual behavior um, in non normative situations involving things or situations that are normally non sexual. Um, and there needs to be some distress or impairment of function. Now, asterisk on that one, for some of these, the distress and dysfunction is not in the individual themselves, but is in others, right? So this is behavior that is causing harm or concern in others. Um, if you're talking about exhibitionistic disorder or voyeuristic disorder, some of these, you're causing harm to other folks. You may be enjoying yourself just fine, but it can still be a disorder in that case, right? Okay, so this is an area that has not necessarily gotten a ton of research. So there are some who have spent their careers working on it, but most researchers prefer more respectable avenues of research and steer clear of this stuff. And so there just isn't a ton of research backing for a lot of the treatments that we're going to talk about. We don't have any well established regimens of treatment for any of these, um, but are continuing to try new things as they crop up. So let's talk about what these are. Take them one by one. Fetishistic disorder, where this is a person who has sexual urges or fantasies involving either a non living object or a non genital body part. So I want to be careful with this because once again, in order for it to be a disorder, there needs to be some distress involved, right? So this is somebody who finds a particular object or part of the body sexually arousing and does not want to, right? If something's arousing to you and you're fine with it and it's not causing anybody any harm, well, that's just sort of your kink, for lack of a better word. And so long as it's not doing anybody any harm, there's no real problem there. But you do get folks who are not okay with this with themselves. And so, why is this happening? Well, Freud would say that it's a defense mechanism to avoid sexual contact anxiety, right? You are um, putting your sexual desires onto a non sexual thing or situation or part of the body because you feel too much anxiety uh, putting that sexual attention onto the genitals, right? Um, the behavioral view would say that we make associations, sometimes unintentionally, between objects and um, the sexual response. Right, that's how classical conditioning works. Is you have a an unlearned physiological response. If it gets paired frequently enough with some scenario or object or whatever, then you can pair those things where sexual arousal becomes related in your mind to a leather mask or whatever the case may be, right? In terms of how we treat it, aversion therapy, where we expose the person to the desired stimulus and induce physically unpleasant um, responses, whether that's nausea through the use of nausea-inducing drugs. Masturbatory satiation is a specific example of this, where the person is actually encouraged to, and forgive me, this is pretty explicit. I know you're probably not used to talking about this stuff out loud. Put in your earphones if you need to. Uh, in that particular type of therapy, the person is encouraged to masturbate while fantasizing about the desired object or scenario or body part, and once they have orgasmed, are supposed to continue masturbating for an hour, which rapidly becomes unpleasant, right? And so that is a particular style of aversion therapy. Um, and so there, pretty much all of the therapy there is designed to create an aversion of some type or the other in the individual. But how well does that work? We don't have great numbers on that. Okay, transvestic disorder. This is not transsexual, not is not related to being transsexual. We'll talk about that in the next video. This is sexual arousal derived from dressing as the opposite gender, right? The most common scenario is cross-dressing men, right? Once again, this is assumed to be acquired through classical conditioning early on. And how do we treat it? Well, we don't know. Aversion therapy, we're not great at this stuff. Okay, what is that word? Exhibitionistic disorder, where someone gets aroused by exposing themselves, their genitals in public. Usually this is not to actually attempt to initiate sexual contact with another person, but rather the arousal comes from the exposure, right? This is most common in men, shocking, and usually starts at a pretty young age. Why does it happen? There are some theories as to immaturity in a person's interpersonal relationships or sexual relationships, fears about their own masculinity, having overly controlling mothers, and once again, aversion therapy is one of the primary ways to treat this. There are some insight therapies where you try and walk a person through how they're thinking about something and try and understand themselves a little bit better. Voyeuristic disorder. This is intense sexual urge and sexual pleasure derived from spying on people, either as they're undressing or as they're having sex. Frequently includes masturbation. And a lot of the excitement apparently comes from the risk of discovery, right? Why? Well, Freud would say it is feelings of inadequacy or shyness that are then channeled into a drive to have power over others. A cognitive behavioral point of view would be that it is a learned behavior that could be traced back to a chance encounter where you ended up observing somebody either undressing or engaged in some sexual activity, and then made that association early on. Okay, frauderistic disorder. This is a sexual urge to rub up against other people, non-consenting people. Almost always men. Again, shocking. And it tends to come on pretty early in terms of age. Okay, pedophilic disorder. This one is perhaps a little bit more common. This is sexual desire toward and fantasies about children. There's a couple of different subtypes depending on whether the person is attracted to prepubescent children or kids in their early teens. Frequently, especially increasingly so as it becomes more easily available, is frequently associated with the search for and possession of child pornography. The majority of victims are girls, and this is a big problem because this is the source of some, if not most, of the child sexual abuse that occurs in our society. This is a disorder that starts to emerge during adolescence. Most folks who experience pedophilic disorder were abused themselves during adolescence or childhood. They tend to display some distorted thinking and frequently have comorbid psychological disorders. This is something that we dislike enough in our society and are enough against that if somebody's caught in this type of behavior, usually they're either sent to prison or some sort of enforced treatment regimen. Once again, how do we treat it? Well, aversion therapy is one option. How well does that work? Anti-androgen drugs have been used sometimes in some places to reduce the amount of testosterone in a person's system and reduce their sexual desire. CBT has some encouraging results where you're teaching people to think differently and sort of break the cycles of thought to behavior that they engage in. So teaching them to recognize their own sort of triggering thoughts and divert their own thinking in another direction and divert their own behavior in another direction as well. That tends to work pretty well. Okay, sexual masochism disorder. This is sexual pleasure derived from being humiliated, beaten, tied up, or otherwise made to suffer. Also does include autoerotic asphyxia, where people will suffocate themselves as they attempt to reach sexual climax. We don't know why this happens. It tends to show up during childhood, or at least the fantasies start during childhood, and may be related to classical conditioning. Flip side of that is sexual sadism, where someone becomes sexually aroused by inflicting harm on others. Once again, usually shows up during adolescence or childhood. And as to why it happens, there's different theories, right? Is it classical conditioning? Is it modeling behavior that you've seen enacted by others or through pornography? Is it a sense of sexual inadequacy that then gets translated into the need to inflict pain? There do appear to be some brain abnormalities associated with sadism, but it happens rarely enough that, once again, our treatment options are pretty limited. So with a lot of this stuff, we're sort of, most therapists will go their entire careers without seeing more than a handful of these cases, and so it becomes hard to gather the data necessary to say what really works and what doesn't.